how will pharmacies, this could be for either Dr. Henry or Minister Dix, how will pharmacies ensure that the right people are getting the tests? If somebody shows up under the age of 70, will they be told they can't have a test? How quickly should those under the age of 70 expect to have access? I know in the presentation you said soon. Is that this week, next week, by the end of the month? What's the timeline in that regard? And how do you ensure those that are symptomatic are the ones that are actually getting the tests as you've laid out in the presentation?
Well, a couple of things, and I'll start and see if the minister has things to add. But one is, we don't want symptomatic people to go into a pharmacy and get a test kit right now. That's not, if you're symptomatic and you're in any of the high-risk groups, or you need to have a test because of your symptoms, you can go to the symptom screener, get a PCR test, or go to one of the testing centers and receive a testing kit there. These are for people to have at home to use when they need to make a decision about what to do when they have symptoms in the future. So we are prioritizing because we know that there's a pent-up demand out there, and we finally have enough that we can distribute them out more broadly to people. But we want to make sure that the access is that we prioritize access for people who are more at risk, and that's our seniors and elders. We know that. We know they've always been most at risk, and that is for them to have to use either for themselves if they get symptoms, but importantly, to be able to use as a tool to screen people who are around them if they need to. So if you're coming to visit, or if there's somebody that's coming into your center, particularly into your home, particularly if they're concerned about symptoms, this is something that people can use to help manage their own risk around them. So yes, we'll be starting, and we intentionally started with people over the age of 70 so that they would get preferential access at the first. We know that there'll be a lot of people who want them now, and as we get more and more available, they'll be available to everybody. But we want to make sure it's easy for those who are most at risk to get them first. And that's going to happen starting Friday. If we get the supplies that we're expecting over the next 4 weeks, then I fully expect it'll be available to everybody to pick up over the next probably 3 to 4 weeks at the most. And so this is not going to help determine what you do today if you're feeling unwell today, but it is something that will help us for the future, for the next few weeks and months. But really importantly, these are tools that we can get used to using in certain situations for helping self-manage our own risk and the risk of our families. And so we know that a lot of younger families will be getting the test kits through schools. Many people are getting access through their workplaces. So we want to make sure that with this first tranche that's coming in, we're prioritizing it and making it easy for elders and seniors to get access as well. And where it will be important is as we move through this transition period now, and hopefully continue to see cases decrease in communities, when we start to see sporadic increase in cases of respiratory illness next fall, maybe, or even before, if that happens, then people will have these tools at home that they can use to help self-manage their risk. Did you want to add anything?
So, Richard, we laid out 2 sets of priorities. The first were students in K-12 and post-secondary education, and those have been going out and will be distributed to them. That's 5.9 million tests. And so that with test packages of 5 is more than 1 million people, which is significant to focus on that group of people. As we make the tests available to broader public distribution, we're starting with people 70 and over. So those are the ones who would have access in the initial period to the tests, and that those age groups will go down, as we've seen with other things, for example, vaccination. So you provide your date of birth and your BC services card or your health number, and get access to the test to your package of tests, so that you'll be able to have that at home. It's a good way to distribute them. It ensures, I think, a common distribution, and it focuses the tests initially on those that most at risk from COVID-19. So it'll be something that people will understand well, and of course all the tests will be provided free of charge to people in BC.
Richard, do you have a follow-up?
Is there any update, I think probably for you, Dr. Henry, from last week when you mentioned that the college are investigating doctors who are spreading misinformation? Is there any update on how those investigations are going or where we're at with those concerns? And also, we're working on a story tonight of 2 firefighters who were required to get vaccinated, and they produced fraudulent vaccine cards. Is this sort of thing acceptable, and what can the province do to ensure that people are not producing fake vaccine cards to their employers?
Yeah, so with regards to the first, I have no insight into the college's processes that they have to investigate. I did see something in the media that at least one physician there was something happening, but I really can't talk to that. You'll have to talk to the college. I have no way of knowing how these things are progressing, but I know that they do have a process that has gone through. In terms of people providing fraudulent vaccine information, this is something we talked a little bit about a couple of months ago. We do have ways of determining if a vaccine record is a true record, and we were following up on a few. I think it was around 1,000 that we knew were fraudulent records. And so that is a process that the PHSA, our IMSS-BC program, has. And if needed, when I know there was at one point some people making profit off of fraudulent vaccine records, that police would be involved. I can't speak obviously to these 2 individuals, but I will say there is a new option now if people had concerns about the vaccines, if they had worries about confidence in the effectiveness and the value of the mRNA vaccines, that they have other options now, including the Novavax vaccine that was just approved for use. So I would encourage people to get the protection that you need, especially if you're in an important position like an emergency responder like firefighters are. Did you want to add?
Next question comes from Maria Weisgarber, CTV.
Hi there. I was curious with the distribution of the free rapid test kits now through schools for K-12. Will the gargle tests also still be made available through schools? I know those were being offered as well for a while for students who are symptomatic at school.
Yeah, so the gargles is a way of collecting, a less invasive way of collecting a sample for a PCR test. And yes, absolutely, we still have gargles available for younger people, also for adults who don't like having a swab stuck up in their nose, and those are available. I know some of the schools are still using those. So the rapid tests serve a different purpose. So they are ones that you can take home to help support those decision makings if and when you develop symptoms at home. So slightly different purpose. They're more thinking about how we manage in the future. But absolutely, the gargle tests are still available at all of the testing centers, and I know are easily accessible in some of the schools. I know it's a little bit of a different program in different parts of the province, but absolutely they are the PCR tests.
Maria, do you have a follow-up?
Yes, I was curious about the online reporting. I know that the province has indicated if people get positive results on their rapid tests, they're asking if people would report results online to the BC CDC. I'm curious about the rate of uptake with that, if there have been many results being reported, and now that there's going to be a wider distribution, is the province still putting a lot of importance on people self-reporting, voluntarily self-reporting if they get a positive result?
Yeah, so it's a bit of a challenge. It is one way of helping us understand, how many people are getting a positive test on the rapid test. But there are many, many limitations, and that's one of the reasons why we're not including it as a routine surveillance stream, because, as you know, the access to tests is changing, and it's only numerator data. So we don't actually know how many tests have been used at any point in time. So it doesn't give us a sense of what proportion of people are testing positive. It does give us a little bit of an idea from in a different community, for example, on who is testing and who is testing positive of the people that are testing. So it really is limited information. And it will be potentially a useful tool, not so much right now when we still don't have a lot of, as testing is access to testing is increasing to the rapid tests, but it can be something where we can target people being able to download that information in a specific community. I'm thinking in the future, if we get down to a nice low level of transmission and then we see respiratory illness going up in a certain community, we can target that community and say, hey, if you're using the rapid test, please let us know if you're positive. And so it is an important tool that we don't yet know all of its how it can be used. We've been talking with colleagues in the UK in particular who've had rapid tests in the community available for quite a long period of time and do have a very similar voluntary reporting online. And there are limitations to that, so we're still trying to figure out where it's most of value.
Next question comes from Lisa Yusta, City News.
Hi there. I'm asking a question on behalf of a colleague, and regarding long COVID. I'm wondering, with Omicron and the faster incubation period, we're hearing from people who are finding that at 2.5 months they're feeling like they're having long COVID, and their doctor thinks they are, but they can't get into the clinics yet because there's a 3-month cutoff. So I'm wondering, is the criteria at this point too narrow? Is it going to change as, I guess, more people have become infected? And I'm wondering, where you're at with that and what you have to say on that.
So there's lots of, there's actually some really good information that's come out of a number of other countries, particularly the UK, who started following this through their family physician clinics, primary care clinics. So yes, by definition, one doesn't meet the criteria for long COVID until 12 weeks from your infection. So that's a standard definition that people are using around the world. It doesn't mean that people don't have symptoms in that period of time, but many people, they'll resolve within 12 weeks. So that's one of the sort of case definition cutoffs. The other thing that we're finding is that vaccination, if you get infected after being vaccinated, and we're seeing that more commonly now with Omicron, your risk of developing long COVID is considerably lower. Much more, 50% at least, but considerably lower. So that's good news, and that goes back to Delta as well. And the number of people who truly have long COVID symptoms that persist is probably less than initially thought. So the data from the UK looks at probably 5 to 10% of people, and that's pre-Omicron. So we're still trying to figure out, as you know, Omicron really burst onto the world stage less than 12 weeks ago, so still trying to understand it. One thing that is clear is that there are a variety of different symptoms that have been consistently associated with people having long COVID, and it reminds us that this is a virus that affects more than the respiratory symptoms, the respiratory system. It has effects on our blood vessels, on our blood system, on our heart, and on a neurological system. So people are, as you mentioned, and talking about brain fog, but things like having loss of taste and smell that can last for quite a long time, and other things that can be more debilitating. So we are still learning a lot about this. And it doesn't mean that if you're feeling really unwell in that period of time, there aren't things you can do. And what I would encourage you to do, if you have a family physician, talk to their family physician. There's the race line, the support line, that the family physician can call to get advice on things that we know can help people get through those symptoms even before 3 months. We know that things like getting rest, those basics that help us get over infections in the first place, but making sure nutrition and getting rest and exercised in a managed way are things that can help a lot too. And that sounds like motherhood things, but those are very important things for helping recover from viral infections.
Lisa, do you have a follow-up?
I do. Regarding the rapid tests and schools, sort of twofold question. I think a lot of parents were under the presumption that their child, like each child, was going to get a 5-test kit. And so there's some frustration with that. And I think when people see 7.4 million sitting in the inventory, wondering why can't they all just go out now? And also, a question was asked, if schools are not vectors of transmission, which have been told all along, why are schools being focused on to get these rapid tests?
Well, I'll start and then I'll turn it over to the minister. But if we talk about 7 million tests, and this is one of my frustrations, my pet peeves. They're not 7 million individual test kits of 5. They're so divide by 5 to think about how many test kits there are there. And initially, the tests that we were distributing through schools were ones that we had broken down from kits of 25 or 35 into 3 or sometimes single kits. So I know some of those have gone out through schools, but the new ones that have come in that were started to be distributed last week come in a box, and there's 5 tests in the box with the reagents, and each child in a family. So if you have 3 children, each child would get one of those boxes of 5. So that's how we're going to be moving forward with it. So we know that schools themselves are not amplifiers, but we know that all of those activities that kids in school can have COVID. And so what the purpose of the rapid antigen tests, and this is something, the at-home tests in particular, this is something that we've been looking at for several months, expecting that we would get more in finally. So it's not, it's to help manage you at home. So if you're at home and you get up in the morning and your child has symptoms, it's a tool that can help you determine whether your child should go into school today or not. So it's for the future, for helping us manage and self-manage and look after ourselves. If if our child is sick this morning, or if we get a test and we're not feeling well, you can make those decisions about whether you're going to go visit an elderly person or whether you need to stay away from your grandparents for a couple of days. So it's to help you make those decisions based on what's happening for you. So, I think about it as we often in medicine will do the test and say, if you don't hear from us, then everything's fine. Well, this is the other way around. You have the test, you use them. And if they're positive and you have concerns, then let us know in the healthcare system. So I think it is a tool that it's not going to solve all our problems, but it is something that people can use to help them make decisions. And it will help us through this next few weeks and months. But it is a tool that we hope will be able to help us as we transition through this pandemic phase and going forward.
And as you can see, because we've been reporting on this every week, we get new rapid antigen tests in from the federal government and we distribute them. We started with the priorities that we laid out on December 21st, which is to support testing centers, support healthcare workers, support long-term care and assisted living in rural, remote, and Indigenous communities, 2 K-12 education, 2 post-secondary education, 2 child care. And these were our priorities, and to support congregate living in different places. And all of those areas that we prioritize have now received sufficient rapid tests to take them into the future, and they'll continue to be topped up. We now have more tests available. We're making them available to students in that system, which I think will be of assistance to parents and to those most vulnerable, those over 70, and we're going to move our way through. And really the thing that will decide how quickly we move through age groups, it will be how quickly we get rapid tests in. So we moved a very significant number of rapid tests to schools last week. We've started the process of going through community pharmacy, and so you see the results of that. As we get more in, we'll distribute more out, and we'll be able to drop the age of where people will be accessible. So a lot of people will have access to rapid tests in the coming weeks, and that will continue to be the case as they become available.
Next question comes from Rob Monroe, Info News.
Hi, thank you for this. Dr. Henry, in looking at the numbers of cases and hospitalizations and such, Interior seems to be declining a bit slower than the rest of the province. I know you've said in the past that Omicron came to the interior later than the lower mainland? Is this just a factor of it's taking longer to work its way through, or are there other factors here?
Yeah, I think there's a couple of different factors. One is they were still dealing with quite a lot of Delta, and it was a bit later that we saw the Omicron surge. But it also reflects the fact that in a number of communities in the interior, and we're seeing this in the north as well, there's lower rates of vaccination. So the virus has much more opportunity to infect more people, and we're seeing that reflected in the numbers that we're seeing in the interior and in hospitalization. So it has meant that the peak has been delayed and also going down more slowly. And the proportion of people in hospital is a little bit higher, but we've seen turning the corner. The other thing that we're also watching is what proportion of cases are the BA.2. We are seeing a little bit of an increase in that. It is more infectious. It doesn't seem to cause more severe illness, but again, more infectious in people, particularly who haven't had their booster dose, who aren't vaccinated. And so that's important too as one of the drivers in some communities.
Rob, do you have a follow-up?
Yes, I do. I just don't know, too, whether there's a concern with Alberta loosening their regulations, and they tend to come to the Okanagan. And do we have any indication that they're bringing that here? And what are you doing to try to get that vaccination rate up in the interior?
Yeah, I know Interior Health is doing lots to try and encourage it and provide information, and it really is going back to those basics, ensuring that people have the information they need to be confident in the vaccine, that it's accessible and convenient for them, and to get over that sense of complacency. And I think we've seen that a little bit with Omicron, that there's this narrative that it is a mild disease, and it is a mild disease in people who have that immune protection, for the most part, not in everybody, but for people who have vaccination, is particularly if you have 2 doses of vaccine on board, then for most people it has been a relatively mild experience. It doesn't mean that it's the same for everybody. And we see that in people who have died, and we see that it is older people, even with vaccination, who are still most at risk. So we need to take those measures to protect them. I would also say that, for everybody in the interior who's not yet availed themselves of vaccine, we now have a new option for you, the Novavax. And I know there's a lot of concerns in some communities. There was concerns about the mRNA vaccines, and I think this is a very effective alternative for you. And I encourage you to call the call center, the 1-833-838-2323, and put your name on the list to get your vaccine as soon as possible. And yes, we do see there's quite a lot of people moving back and forth between Alberta and parts of the interior and the north. What we need to say is, when you're here, we expect you to do the things that we're all doing to protect each other and our communities here in BC. So that's following the guidelines that we have in place, making sure that you do avail yourself of the opportunities to get protection through vaccination.
Next question goes to Cole Skizler, Black Press.
Cole Schisler. Thank you for taking my question. It's not long COVID. So to access the post-COVID-19 recovery clinic, people need to have a positive COVID-19 swab or a positive serology test. During the peak of our Omicron wave, testing capacity was limited here in the province. So for people who were unable to access a test because of lack of supply, who may have got Omicron and may now have long COVID, what supports are available for those people?
Yeah, so there is a serology test, as you mentioned, that can tell whether you've had an infection with COVID. So that's one of the things that the clinic can do. So again, it's talk to your family doctor if you have one. You can call 811 to get advice about how to do that. But talk to your clinician, make sure you can get that the signs and symptoms are assessed. Your physicians and nurse practitioners can get direct access to clinicians who are working in those clinics. We only they're not available in every community, but they are designed to be a hub and spoke so they can support your family physician in your community in supporting you as well. And part of that assessment, if you've not had a test and you have had COVID-like symptoms, is to get a serology test that will help understand if you were infected or not. And yes, you can tell the difference between some of the immune markers from vaccination versus from infection. So that is available, and the clinicians in the post-vaccination or the post-COVID recovery clinics can provide advice on how to get those tests if they're indicated.
Thank you. Cole Schisler, do you have a follow-up?
Yes, thank you. Does BC recognize long COVID as a disability?
Yeah, that's a very good question. So it's not our role to recognize a disability. It depends on the symptoms that somebody has. And it would depend on the circumstances that they have. So if somebody for work, for example, it would go through things like WorkSafe BC assessments to determine if it was a work-related disability. So yes, some people who have long COVID do have disabilities, but it's specific to the individual, and it depends on what signs and symptoms they have and how it affects them. So that's a discussion that's between an individual and their clinician about how the illness is affecting them individually.
We have time for one more question today. We'll go to Karen Larson, CBC.
Oh, hi. Thanks very much. I would like answers in English and French, if you could, please. So, Dr. Henry, how do you explain what appears to be a relatively low rate of vaccination for 5 to 11-year-olds?
Yeah, well, this is something, actually, we had a long conversation about that with colleagues across the country, as well as some international experts just today. This is something that we're seeing across the board. If we look at, we're at about 55% here in BC, and that's about the same as Ontario, Quebec, and most of the provinces across the country, with the exception of Labrador, where they have overall much higher immunization rates. It is also aligned with the polling. Early on, before vaccine was available, we asked parents about intentions to vaccinate younger children. So I think there's some, and it's what we heard. We heard that about 50% of parents were going to sign up right away. And then there was a proportion of people, 20 to 30%, who wanted to understand more and wait until they saw more information, more data about the vaccine. We now know quite a lot more about how COVID is affecting that younger age group and about the safety of the vaccines, how well they're working. So we are all at a point now where we need to look at, okay, what do we do to provide that information that parents are looking for and to support them in getting children vaccinated? So again, I think it is important. We have seen, and we've seen in our data here in BC, a higher number now of younger children because it's been, Omicron has been transmitting so wildly. We're seeing more children need hospital care. Thankfully, it's still quite low in terms of rates, but it does mean that the more children who are affected, the more children will have severe illness and end up in hospital, either from exacerbation of asthma or other illnesses or from COVID itself. So it is important to protect children, and now we have a lot of information about how well these vaccines work and how safe they are. It's also, I believe, really important for helping to get us through these trying times for children, particularly in schools, to make it easier for them to participate fully in activities and not worry that they're bringing it home to family members who may be more vulnerable. So there's a whole lot of reasons why it is important to continue to provide the information that's needed and for children to be vaccinated. And I really encourage parents, talk to your pediatrician, talk to your pharmacist, talk to your public health nurse in your community, because we have lots more information now that really support how safe these vaccines are, how well they work, and the impacts that COVID has had on younger people. because we do need to get those immunization rates up. I think it's going to be really important for getting us through this transition phase, but also for protecting young children for what comes next.
I think, and we'll share this with you, Karen, which you may be interested in, with reporters. If you go from the age of 17 down, and under 18, every time you go down 1 year age cohort, the number of people, youth or children vaccinated gets less and less. So 17 and 16-year-olds are actually vaccinated above the provincial average of vaccination, then it declines every individual year cohort down to age 5. And the other thing we see in the numbers is, well, there isn't a great deal of difference between adults over 70 in different parts and living in different health authority regions in the province. There is a significant difference between children 5 and 11 as by health authority, with the highest levels of vaccination for children 5 to 11 being in Vancouver Coastal Health above the 70% mark. So those are the basic informations pour dire en français que je pense que nous allons continuer à nous efforcer de communiquer le message, c'est-à-dire que ces vaccins sont très efficaces et c'est très important pour des enfants de 5 à 11 ans de recevoir leur vaccination. Et on va continuer ce travail. C'est à peu près 56% maintenant. Le nombre de gens qui ont reçu, d'enfants de 5 à 11 ans qui ont reçu leur deuxième dose continue à augmenter, et je pense que cela démontre que 56% de la population sont déterminés que leurs enfants soient vaccinés, et que les autres ont des hésitations, et il faut travailler. On a démontré depuis des mois l'efficacité et la protection donnée par ces vaccins, et il faut continuer à travailler avec les parents, et c'est ce que les parents ont indiqué avant le commencement de cette affaire, et il faut maintenant continuer à travailler avec eux pour mieux communiquer ces renseignements, pour que des gens soient en mesure de prendre des décisions appropriées.
Karen, do you have a follow-up?
Yes, I do, and English and French again, if you could please. Minister Dix, is there anything the province could have done differently than to try and increase those numbers of the 5 to 11-year-olds, or to convince parents to vaccinate their children? And should we expect a different strategy?
Yeah, so, we had a very intentional strategy based on the information that we received from parents and from guardians and from community members about what they were looking for in vaccinating children. So we have done it in a whole variety of settings, but we really have focused the things that we heard that were most important. We're having immunizers who were used to dealing with children and being with children, and having clinics that were designed to make it an experience that was as least traumatic as possible for children. So we've done that, and you see as we're transitioning to much of the mass clinics being scaled back, we're focusing on having those important experiences where you can bring your child, even if they have concerns, even if you're worried that they're going to scream or be upset or be concerned, because we know that the people there at those clinics know how to make this an experience that's positive for children, and to make sure that they are vaccinated in a way that supports them. That was the number one most important thing. So we have been focusing on that. Having said that, in different communities, we have tried and worked on many different aspects of the supporting families, making sure it's in a place where they feel comfortable, in a language that they feel comfortable. The information is in a format that resonates and that answers the questions that parents have. So there's a lot that we've done, and we will continue to follow along with that strategy, a parent, a family, a community at a time, to make sure that we're providing those opportunities for all young people to get vaccinated. And I mentioned we were on this call. This is something that we're seeing in many communities around the world. and that it is really about addressing what I keep calling the 3 C's. So, complacency, the sense that children aren't at risk. Convenience, making it easy for parents, making it in a language that they understand, in a setting that they feel comfortable. All of those things are really, really important. And confidence in the vaccine. And as we have more and more young children vaccinated, and we've seen the effects that COVID is having, particularly Omicron, over the last few weeks, we have more and more information to build confidence and to share with parents. So we will continue to really focus on addressing those needs for families and for parents and for children.
And as you know, 93.5% of adults over 18 have received their first dose COVID-19 vaccination. Over 91% have received their second dose. Of those eligible, well over 60% of adults have received their booster doses. So I think there's a strong understanding of the need for vaccination. We talked to people prior to the approval of the pediatric vaccination from 5 to 11. Many parents told us that they wanted to wait a while. Well, 200,000 children now have, or just under 200,000 children have received their specially designed pediatric vaccine, and it's proven to be effective, it's proven to be safe, and I think this is a moment we're going to continue to see parents bring their children to be vaccinated. So we're continuing to grind those numbers up slowly, and I expect we'll continue to do so and that we'll succeed in it. I think one of the differences between the availability of vaccines for adults and the availability for children, it was a little different. You'll recall that we got access to the vaccines on December 13th or so of 2020 for adults. But because of supply, it was quite a bit of time before most adults had access to them. We focused on long-term care and other things, so people had time with it. Whereas with the pediatric vaccines, basically we had sufficient vaccine immediately. So that period, which some people took to wait and consider, was not available. And so we believe, strongly believe, that the evidence is so strong that it makes children safer, that it makes their families safer, that it will make everywhere around them safer, that we're going to continue to see those numbers go up. There are regional differences, though, and so we have to continue to provide information. You saw that Fraser Health put out an information bulletin today about some new places where the pediatric vaccine will be available. And what I would say is, and what will continue, is a real focus of public health on ensuring that the people doing the vaccinations have lots of experience with children. And the experience that I've heard from parents is how positive it has been at our vaccination clinic, and that has everything to do with the extraordinary work done by public health nurses and doctors and others.